Let's make our way over to the wall, bringing our dominant arm up into a high V. The inner edge of your wrist will be on the wall, and you'll slowly twist away from that arm, keeping the shoulders plugged down, feet hip distance apart or together, hands on the hips or hand on the hip, shoulders plugged down, chin lifted, gaze soft. Breathing into that nice shoulder opening. As you're here, let's connect with the breath. Belly is in. Lateral breathing into the rib cage and side body like you're an opera singer. Lifting in and up on the muscles that stop your stream of pee to contract the deepest layer of your core, your transverse abdominis. So we can pull the belly in. Inhale into the upper back and side body. Lift up on the muscles that stop our stream of pee, holding the breath. And fog a mirror as we exhale. Again, inhale, 2, 3, 4, contract and exhale. 2, 3, 4, one more. Inhale, 2, 3, 4, contract and exhale. 2, 3, 4. Slowly switching sides, setting up on the other side. Breathing here, inhale, and exhale to twist away from that arm on the wall. Inhale, plugging the shoulders down, brace the abs, and exhale, twisting away. Inhale, 2, 3, 4, exhale, twist, 2, 3, 4, one more breath, inhale, 2, 3, 4, exhale, twist, 2, 3, 4. Let's grab a chair. Coming into a chair, hip flexor stretch with our dominant leg back first. Make sure your front foot is solidly grounded on the floor. Place a yoga block or book under it if the chair's too tall. If the chair's too short, place a bolster, book, or yoga block under your pelvis to elevate it up. You're going to be in a nice supported lunge here. Opening up the back legs, hip flexor. Feel free to take the same arm as the back leg up in the air to shoulder flexion, plugging the shoulder down, side bending towards the top of the chair. Inhale, feel your pelvis pulling towards the floor. Exhale, feel your low abs pulling in and up. Again, inhale, pelvis grounds down towards the floor through the seat. Low belly pulls in and up as you exhale that air out. Keep breathing here, deepening into this posturally tight area. It's important before we begin moving at 100% effort that some of the tightest areas of your body are opened up, the quads, the hip flexors, the pecs, the shoulders. This way there's no chance of an injury when you're going at 100% effort. Slowly, let's make our way to the second side, setting up to open up those hip flexors. Breathing here, inhale and exhale. Keep that going, inhale and exhale. And avoid belly breathing here because of the lordosis, because of the extension in your pelvis. I want your belly in, and I want you breathing into the side body and upper back, pulling the belly in tightly as you tug in and up internally on the muscles that stop your stream of pee. And you exhale that air out the mouth. It'll sound like ocean breath. From here, let's slowly make our way up. We're going to learn all three of our exercises using our slider discs. You can also use washcloths if you don't have slider discs. For all three exercises, we're going to have our heaviest loop band around our outer thighs. We're going to do so to improve knee tracking, build up the strength in the legs, so that as we decrease the resistance, the abs fire, the legs track appropriately. So let's bring the gray loop band around our outer thighs and our slider discs under our metatarsals. That's our toes, and a bit of the arch of the foot. So the heels are off your washcloths or slider discs. From here, the first exercise we'll do in the frontal plane. Arms are up on guard. That means the elbows are about as high as the shoulders. 2 right angles. You can make fists with the fingers or with the hands, like so. We're going to sit back on our exhale and side walk in a normal squat. The inner thighs pull us back into it 4 times. We'll stop on the other side. And then we will do 4 alternating hooks. They look like this. 1, 2, 3, 4. Pause, inhale. Exhale, inner thighs pull you back into the squat. And you walk back to the other side for 4 counts. And then we do, so notice that I'm doing side leg reaches. I'm alternating as I do those hooks for 4, 3, 2, 1. I pause, inhale. Sit back, exhale, walk to the side. 2, 3, 4. Inhale up, exhale, cross hooks. 4, 3, 2, 1. So this is our first exercise. Our next exercise, we'll have this band on as well. We're going to begin with 2 cross punches in a reverse lunge. Looks like this. We go 1, 2. Watch out for pitching the upper body forward. Keep your upper body upright. Slide back into that lunge. That means the front knee must bend. Equal pressure between the baby and big toe on your front leg side. There's weight in that back leg to slide that slider back. Your body is upright. You do your 2 punches, and then you switch to the other leg. You do 2 cross punches, and we're always punching over the front leg. So you've got that rotation over your front leg, engaging the transverse abdominis, that deepest layer of your core. Once you've done those 2 cross punches on each side, bring the arms back up on guard like we did in the frontal plane. And you're going to do forward leg reaches, keeping the legs close and keeping your knees bent and your pelvis tucked under like a scared puppy. So 4, and we're turning. 3, 2, 1. Now we repeat. We take our reverse lunge, 2 cross punches. Don't pitch forward. 1, 2, bring it forward, switch, and 1, 2, arms back up on guard, tuck the pelvis, deep bend in the knees. 4 leg reaches to turn back from where you came from. 4, 3, 2, 1. Let's repeat at 50% effort here. Go 1, 2, cross punches and your reverse lunge. 1, 2, arms up on guard. 4, turning. 3, 2, 1. So that is our second exercise in the transverse plane. Our final exercise in the sagittal plane. I'm going to have you keep your arms up on guard. We're going to be doing side leg reaches with a cross punch. It looks like this. 4 traveling forward. 4, 3, 2, 1. At the top, come into a sumo squat. Keep your body upright. Brace the abs. Inhale, prepare. Exhale, 8 uppercuts. So the legs are stationary. These uppercuts are the arms. Bracing the abdominals. Give me 8, 7, 6, 5, 4, 3, 2, 1. Inhale, back upright. And exhale, 4 cross punches with the leg reaches traveling backwards. 4, 3, 2, 1. Pause, inhale, sumo squat, torso upright. Exhale, 8, 7, 6, 5, 4, 3, 2, 1. Again, cross punches forward. 4, 3. Side leg reaches with that. 2, 1. At the top, sumo squat. Uppercuts. 8, 7, 6, 5, 4, 3, 2, 1. And our cross punches. Traveling back. 4, 3, 2, 1. Sumo squat. Sit back. And you go 8, 7, 6, 5, 4, 3, 2, 1. Grab a sip of water. I'm going to do so. And now from here, we're going to set up for our first burst at 100% effort. So this is in the frontal plane. Reminder, this is where we set back in the squat. We walked for 4 counts. Inhale up, 4 alternating hooks. Okay, counting you in 10 seconds. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 100% effort. You can do it. Give it all you got. Push yourself. This is for your heart health. This is for your stress and anxiety management. Cardio bursting is the most time-efficient way to work that heart health, and it's also a lot of fun. You're going to burn a lot of calories. Make sure you're giving me 100% effort. We've got our 4 count and our 4 count. So we inhale, prepare, exhale, sit back into that squat. We walk for 4 counts. and then we inhale up, and then we exhale hook for 4 counts. So I like to move on my squat on the exhale and move on those hooks on the exhale. Inhaling to start the movement and set up. Keep going. You've got another 15 seconds of 100% effort. You're doing great work. Use that breath. You can do it. If the knees are hurting, brace your abs. Really use those low abs. Keep your shoulders plugged down. Counting you down. 3, 2, 1. Take a break. So for your break, just make sure you don't sit down. Feel free to grab water. Take a stretch if anything feels like it needs to be stretched. We're going to repeat that exercise one more time. I'll let you know when you have 15 seconds. So if you want to take the band off, you can take it off and you can put it back on, but feel free to keep it on if it's not bothering you, just so you don't have to take it on and off. You've got another 30 seconds of recovery. Stretch, get water, stand, just stand there, let that heart rate come down, and we'll spike it back up. It's all about conditioning the heart, getting it to go up and back to a normal rate. We don't want it to go all the way down to resting, so that's why I don't want you sitting down. 15 seconds. Get yourself set up. I'm going to count you in. 5, 4, same exercise. 3, 2, 1. Here we go. Sitting back into that squat. Walking for 4. 3, 2, 1. Inhale up. Exhale 4 alternating hooks. Get those going. Push yourself. 100% effort. You can do this. Find your target. Anything or body that's been driving you crazy, use them as that target for those air hooks. Breathe into that. When you sit back, let those inner thighs pull you back. Keep your belly firm. Remember that lateral breathing we discussed when we were opening up your chest and your shoulders earlier. So breathing there, lifting up on the muscles that stop your stream of pee to contract the deepest layer of your core. Keep your gaze always a little higher than eye level. You're doing great. 10 seconds to go. Feel all edges of the feet. Use the feet. Stay deep in those knees, bending, using your legs. 3, 2, 1. Take your break. You've got a minute to recover. Stretch. Sip water. Just don't sit down. So I'm going to remind you, feel free to watch. You don't need to do this because this is your recovery time. But our transverse plane. So I'm going to demonstrate cross punches. 1, 2, switching legs. We've got that reverse lunge. 1, 2, then the arms up on guard. Forward leg reaches. Stay deeply bent in the knees. Pelvis tucked under for 4, 3, 2, 1. I repeat. Cross punches. 1, 2. I'm not pitching forward. I'm keeping my torso upright. And then other side. 1, 2. Arms up on guard. Pelvic flexion. Deep bend in the knees. 4. Reaches to turn. Okay, you got 10 seconds. Get set up for your first set in the transverse plane. Counting you in. 4, 3, almost there. 2, and here we go. 1. Let's do it. Working hard, keeping those abs tight. Shoulders plugged down, collarbone wide. There's a tendency to pitch forward on the lunges. Don't let that happen. Keep your abs in, torso upright. When you're doing those that puppy dog pelvic flexion, access those lower abs like a reverse crunch. Stay bent and low in the legs there. I don't want you up on your tippy toes. So I want you to feel the legs, the feet sliding on the floor on those forward leg reaches. Halfway there. 30 seconds to go. You got this. So this is a great exercise because we get the abs, both the lower pelvic floor, the transverse abdominis, the deepest layer. We get some oblique action when we're in the reverse lunge and doing those twisting punches because of the imbalance. We're getting the hamstrings as you slide back against that band and the central glutes, the butt muscles, the glute max, glute min, counting you down. 5, 4, 3, 2, 1. Take your break. 1 minute here and we'll repeat. We'll do our final set in the transverse plane. If anything's bothering you, there's a tendency for knee traction to be an issue with lordosis, so feel free to take a quad stretch like so, grabbing your outer ankle, pointing the toes. Get some water. I'm going to take another sip. Remember, at least 8 cups of water, that's 8 ounces a cup a day. If you are drinking coffee, caffeine, or alcohol, you're going to want to add an additional cup. So a cup of coffee means 9 cups of water a day to be hydrated. You have 15 seconds before we begin our second set in the transverse plane. Use this time to mentally prepare to go at this at 100% effort. Counting you in. 5, 4, 3, 2, 1. Here we go. Give it all you got. Final set in the transverse plane. Cross punches. Switching sides for those cross punches. Arms up on guard. Elbows as high as the shoulders. Pelvis tucked under like a scared puppy. Forward leg reaches, staying low in the legs, using the heel, arch, and toe to slide that slider forward. Make sure when you go into your lunge, your front knee is tracking over the second and third metatarsals. It will do so if you pull back into that lunge using your inner thigh strength. So sometimes we tend to use the quad and let the torso go forward and squeeze the front of the thigh. I want you to use your butt muscles and the backs of your legs as well as the inner thighs to pull you into that lunge. You're doing great. 10 seconds to go. Push through it. Counting you down. 5, 4, 3, 2, 1. Take your break. So I'm going to remind you of our final exercise in the sagittal plane. No need to do it. You take that recovery, stretch, water, whatever you need. So 4 leg reaches with a cross punch traveling forward. 1, 2, 3, 4. At the top, I find a sumo squat. Keep my body upright. I inhale. And I exhale and do 8 quick uppercuts. 8, 7, 6, 5, 4, 3, 2, 1. Back upright, inhale. And 4 leg reaches back with our cross punches. 4, 3, 2, 1. Inhale, set up. Sumo squat. Sit low, inner thighs pull you back. 8, 7, 6, 5, 4, 3, 2, 1. Those uppercuts. All right. You have 15 seconds before our first set in the sagittal plane. Get ready. I'm going to count you in. 5, 4, 3, 2. Here we go. 1. 100% effort. I like these cross punches and leg reaches. They feel really natural, I think. As you get going faster, sometimes you'll lose the slider disc. That's fine. Just get right back to it. At the top, if you're feeling pressure in the knees, you could be leaning forward too much. I want you to use that band. Push those outer thighs into that band. Feel the lateral hamstrings, the outsides of your butt muscles. As you sit back into the sumo squat and you do your 8 uppercuts, brace your abs. As you travel backwards, keep the abs tight. Keep the shoulders plugged down. Keep your focus up a little higher than eye level. All of our checkpoints are important. We're going to improve our alignment to decrease the chance of injury and for a better quality of life, improvement in functional movement. Counting you down. 3, 2, 1. Final break before our final burst. You've done excellent work. It's important that you hydrate. I bet you have been as we've been going along. Cardio is always a wonderful time to keep sipping water, get a lot of your water in. If weight loss is a goal, I'd encourage you to always have water with you when you're eating meals. And for every 10 bites of food you take 10 sips of water. So do not take more than 10 bites of food without following it with 10 sips of water. You'll find yourself fuller. You'll learn portion control and to eat smaller portions to lose that weight you so desire. Complementing it with your cardio is imperative for tonality and for your heart health. Counting you in, final set in the sagittal plane. 9, 8, almost there, 7, 6, 5, 4, 3, 2, here we go, 1. 100% effort. It's the last minute of cardio today for you. Then you can go into flexibility with us and a nice cool down. So let's give it all you got. Cross punches, sumo squats, uppercuts. Hear your breath. I like to use my exhales to do the cross punches and leg reaches. Pause on my inhale to set up in that sumo squat. Move on those uppercuts on my exhale. Inhale, prepare, and then exhale, leg reaches and cross punches back. So Same idea of the exhale being where I'm bracing and lifting up on the muscles that stop my stream of pee, and that is driving the movement. Initiating from my center. Stay low in your legs on those leg reaches. Don't get up high on your tippy toes because we want to use the hamstrings and glutes. 10 seconds to go. Are you giving 100%? How much more can you give? Keep your abs engaged. 5, 4, 3, 2, 1. Great job.